Is my case study presentation about music therapy in adults with PTSD. So first off, I'll start by explaining what PTSD is. Um, Post-traumatic stress disorder is a debilitating trauma-related disorder resulting from exposure to a traumatic event or events. So it can be either one or multiple. So then the first intervention for this that I decided to research was pharmacotherapy. So, one of the most common, excuse me, of all the different types of pharmacological approaches, tricyclic antidepressant medications worked better overall than other drugs like anticonvulsants and benzodiazepines. So, one of the most common pharmacotherapy approaches is the use of SSRIs, or selective serotonin reuptake inhibitors. These are medications such as fluoxetine, paroxetine, and sertraline. The largest issue with these, however, is the fact that less than 60% of patients respond to these medications. And along with these medications, there are quite a lot of side effects. Um, so then another difficulty with pharmacotherapy is the adherence to it. So it may be harder for people to remember to take a specific medication like fluoxetine um, every day versus going to meet up with an individual or individuals once a week. So then moving on to cognitive processing therapy. Cognitive processing therapy, or CPT, is an extremely common type of therapy. The goal is to reduce avoidance of emotions that are associated with traumatic events or events. So this is done in multiple formats, but a very common format for people with PTSD specifically is a combined style format. This means that there were both individuals and group sessions. The individual sessions focused more on processing trauma-related details, whereas the group sessions were used to help learn and practice various skills with other members of the group. While this type of therapy does improve symptoms, this is not a large amount. So there's only certain space for other therapies as well as this one that would result in better outcomes. Compared to other types of therapy for PTSD, CPT has an extremely high dropout rate as well, with numbers ranging from 22 to 34%. So then moving on to the music therapy interventions. The first one I'm going to talk about is group drumming therapy. So the primary goals of this study are to foster safety, increase self-agency, and question assumptions of leadership in order to increase independence, autonomy, and initiation of musical ideas, and then also to alleviate re-experiencing, avoidance, hyperarousal, and associated depression that are all symptoms of PTSD. So the way this was done was it was a 10 weeks. It was used for 10 weeks, 90-minute periods. Um, and the intervention began with weeks 1 and 2, introducing the instruments and the idea of improvisation. This was used to help encourage the group cohesion and reduce anxiety. By the second session, they were able to eliminate instruments that were difficult to tolerate. So these were usually like higher pitched instruments, specifically like wind chimes. Usually those got taken out because they were higher pitched instruments. After these initial 2 weeks, the group was able to identify that drumming helped facilitate cohesion and expression. Um, it also enabled members to lead the group, and that continues until week 7 or 8 of the 10 weeks. At this point, the group moves towards preparing for ending. So this is more centered around the positive effects of music and not having bad thoughts and being able to get in touch with the pre-trauma self and memories. So trying to bring back more of who they were before the actual uh, event or events occurred. And then there was also an emphasis on free improvisation with the individuals. So the clients or patients were introduced to the instruments and then encouraged to improvise. The therapist would the therapist would follow with the close accompaniment on their principal instruments. Typically, this would be done on like a piano or guitar, though. So then the music therapist responded to the music in two ways. Um, One, imitating an aspect of an individual's music, And two, providing a broader structure to encompass the expressions of the whole group. Um, and then afterwards, there was also a time for a verbal reflection. And while patients were not required to do this, they were encouraged to. And this steadily increased over the sessions. So weeks 1 and 2 were pretty quiet in terms of this, but moving forward into, especially into what, weeks 7 and 8 and into the very end of it, there was much more discussion, and it was thought of as a much safer environment. So, one of the most prominent things that's helpful with this intervention is meeting other people. Not only is this method more inclusive, but is but it is also used because of the strong and steadying rhythms that are used. So, in these groups, you're always going to have a strong underlying rhythm with the drumming therapy. And this is considered a very relaxing, soothing thing. Um, and then finally, about this intervention is that this has been growing rapidly in recent years because of the inclusiveness and the strong, steady rhythms and so forth. Um, Overall, it is considered a very safe, enjoyable, and motivating intervention. So then finally, moving on to the last intervention, guided imagery and music. So guided imagery and music uses special selections of classical music or other types of music to evoke spontaneous inner imagery. This specific method is, this specific intervention is a modification of the original Bonney method of guided imagery and music, and it was adapted for patients and the need for PTSD patients and their need for stabilization, safety, and control. So this occurred over 16 weeks, meeting once a week for 60-minute periods, and there were 4 specific phases that were used. There was establishing stabilization and safety, experiencing containment of a mixed emotions, grief and trauma processing with music, and orientation towards the future. These happened in this order as well. So then this was all done by a list of steps. So it began with using short music listening periods that lasted from 2 to 10 minutes. And then they would also use supportive music, give several options to choose from. So oftentimes what would be done is they would give them 3 or 4 different options of music. And then those patients, as I'll get to here in a minute, those patients then would take that music home, listen to it, and familiarize themselves with the music. Um, so then the next thing is giving several options to choose from, is listening and sitting upright in a chair. This is because laying down is commonly associated with those traumatic events and having those flashbacks. So you're supposed to have them listen and sit upright in a chair for that reason. The next is giving the option of listening to music with eyes open or closed. Um, this helps the clients to have more control, feel like they have more control over the situation, and to overall be more comfortable. Uh, and then next is giving the ability to stop or lower the volume of the music in case of a flashback. So this is very important, especially earlier on, because there are more things that they are more susceptible to possibly being triggered by something that happens. So this also gives another sense of control and a little bit more comfort, as I was saying before. Um, Next is listening with or without verbal communication. So oftentimes these sessions would have absolutely no verbal communication. Um, Rather, it would just be music on. So then after that, another thing that was always done was they included calm music. So it was never anything that was, it was never anything that was, for instance, like hard rock or heavy metal or that sort of thing. It would always be classical music, in a couple cases, pop, more soothing music like that. And then finally, as I mentioned a little bit earlier, giving patients the music for listening at home between sessions. So this would be geared more towards, especially in the earlier weeks, the clients or patients would take the music home with them at the end of the session, and they would be asked to familiarize themselves with it. That way, during the sessions, it is a bit more relaxing to them. They already know what is already kind of happening. So, yeah. And then here are a list of all the sources I used, and yeah, thank you.